always when a pregnant mother goes to clinic, her midwife and her gynecologist and the medical team around always advise her that when she gives birth, she breastfeed for 6 months exclusively. Now today at Kijabe Mission Hospital, we are privileged to visit the newborn unit where we find a beautiful lady, Dr. JECINTER, who is going to tell us more about exclusive breastfeeding. Why should we do it? Now, Dr. how are you?
Yes, I am fine.
Now, before we talk about breastfeeding,
yes,
I see your room is beautiful.
Thank you.
I wouldn't mind if you told us what all these machines are for and why should we have them and why are they important when a baby is born?
Good. So on my left is an incubator. So the incubator is basically to keep babies warm, and especially babies who have arrived before their dates. That one means they have been born before 37 weeks of pregnancy. So this ensures they don't lose heat and they keep warm. Yeah, so that it enhances their growth.
And then does it remain open as it is?
No, usually it remains closed. And we only open it if we are to do just a minor procedure. We use the 2 windows. But if you need to handle the baby, yes, we can open it. Yeah. So when you're doing minor procedures, you can use the small windows.
So you don't have to open
We don't have to, because our aim is to avoid heat loss. So we don't want to expose the baby more.
That is very good.
Yeah.
Okay.
If the baby is sick and you need to do procedures like resuscitating or reviving the baby who is has difficulty with breathing, then you'll have to open the bigger door, and you do that, and you ensure you do it for the shortest time possible, and then you close it back. Yes. So behind me is an overhead light, which basically we use to help us concentrate light on the babies, especially when you're looking for cannulas. We want to insert an IV cannula for drugs, probably for feeds. Yes, so especially if you're in a room where the lighting system is not enough, so you use this to concentrate the light. Yes.
So akanyura ni sindano.
Ile sindano unaweka kwa mkono kuwekea mtoto dawa.
That is very nice.
Yes.
And behind you there is a bed.
So this is called a resuscitator. So resuscitator basically it has a heater and it also has a light. So what we use the resuscitator for is to receive the babies when they are born. So remember we have said newborns lose a lot of heat. So we need to receive them in an area which has been preheated. So usually this is prepared. Once the gynecology team or the maternity have told us they have a baby, so we prepare this, we preheat it, so we receive the baby in this couch.
So every baby that is born must pass through that?
They pass through here, especially if they have difficulty like breathing, they are cold, and we still need to observe them. For the babies who are born very well at term, a vigorous breastfeeding, we keep them with the mothers.
That is very good. Doctor, we have another small machine over here.
So this small green machine is called a fluid pump. So basically we know when the babies are born, they are very tiny. And in our newborn unit, sometimes we have babies as small as 500 grams.
500?
500 grams.
And they will survive?
Yes. So, right now we have, the smallest we have is 800 grams. Yeah, but the survival rate for the 500 grams is not very good, but we try to do our best. So usually when they need fluids, because at that age they can't feed, so we give them feeds through the vein. So we use this pump to ensure we don't push too fast. So we give it slowly, and that is what is safer for them.
That is very nice.
Yes.
I see another table behind.
Yeah, so on my right is what we call a phototherapy box. So this phototherapy box has bulbs. It has several bulbs down here, fluorescent tubes.
Do they light?
Which basically give us light. Have we connected it?
There's a connection over here.
Yeah, they can light. So, so it produces that blue-green kind of light. So we usually put the babies under it, and basically the babies who need it are the ones who have something called jaundice, the yellow discoloration that many babies develop. So some of them sometimes need treatment, and this is the mode of treatment. So
this is one of the treatments they receive?
They receive.
And for how long can a baby stay here?
So the duration of treatment using the phototherapy will depend on how the bilirubin levels will be progressing. So like every day when they are here, we continue to check the levels in the blood. That's like using a lab test.
I think someday we should discuss jaundice.
Yes, thank you. You're welcome.
Doctor, I see another machine over here.
So this machine on my right is called an oxygen concentrator. So it's basically used to mix oxygen, 100% oxygen with air to ensure that we give the babies who require oxygen the right concentration of oxygen.
Okay. Can you tell me which are these babies that are given oxygen?
So the babies that require oxygen mainly are the ones that are born with difficulty in breathing. They are not able to get enough oxygen into their lungs. So usually when we connect them to something called a monitor, we see their oxygen concentration is very low, so they will need oxygen. And that includes babies with like pneumonia, they have a heart problem, or basically just the ones who have been born before their dates, the very small ones, the prematures.
And are there sometimes you have to give oxygen to a mother, maybe like the mother has not yet delivered?
Yes.
Are there times you can give oxygen to the mother?
Yes. Now, we all know that the delivery process, which is labor, is a very stressful process. So for some mothers at that point, they may actually go into develop difficulty in breathing, and they might actually require oxygen.
So oxygen can give...
It can be given to all ages, yes.
Okay, that's very good.
Yeah.
Daktari, other than the babies who have not gone up to 37 weeks,
yes,
are there other babies that you admit in the newborn unit?
Okay, so we usually admit children who have features of infection, so that we give them antibiotics. We admit babies who need this phototherapy, the ones who have jaundice. We also admit those ones who have not been able to breastfeed, because most babies are able to start breastfeeding, but some have difficulty. So we admit them there as we observe to establish the breastfeeding.
That is very good.
Yes.
Thank you for being there with us. This is once again your best show, your most educative show, Golden Minute Show. Remember, we are at Kijabe Mission Hospital. After the break, we're going to talk about breastfeeding. Why should a mother breastfeed for 6 long months? Asante sana kwa kuwa pamoja nasi. If you've just joined us at Kijabe Mission Hospital, we are discussing breastfeeding. Why should a mother breastfeed exclusively for 6 months? Kindly, for your comments and your questions, use the number on your screen. You will reach us, we will reach you. Daktari.
Yes.
Breastfeeding.
Yes.
Why should a mother? Na kwanza, tunawaambia to breastfeed when they are pregnant. Why?
Breastfeed.
Yeah, we prepare them for breastfeeding when they are pregnant. Why?
Yes. So it's very important to talk to the mother about breastfeeding when they are pregnant, to prepare them, basically to give them knowledge concerning breastfeeding, and to tell them why it is important to breastfeed. And then, of course, breastfeeding has a lot to do with the psychology of the mother. So when she's prepared herself and she believes she'll be able to feed her baby exclusively on breast milk, she'll be able to do it more comfortably. So that's why it's good to do it during pregnancy.
So why is it important to breastfeed for 6 months?
Okay. So from studies that have been done, it has been shown that the first 6 months of life, the breast milk is basically adequate for the nutritional requirements of the baby. So they're able to get all their energy from that food and all the nutrients that they need. Yes. And then the breastfeeding is basically important to the mother, it's important to the baby, it's important to the whole society and the family at large. So to the baby, the breast milk is basically important because it provides all the nutrients, and remember the baby needs nutrients to grow. So they need to increase in weight, they need to increase in length, and basically in the long run it's going to prevent whatever we call malnutrition. The second thing, that reason why it's important for the baby, the breast milk has components that help to fight infection. So you realize that the babies who are exclusively breastfed for 6 months do not need hospital admissions as frequently as the ones who are probably formula fed or given other feeds in the first 6 months. And those diseases that it prevents are like diarrhea, ear infection, pneumonia, and later on it prevents things like hypertension, obesity, and high blood pressure.
So
yes,
you want to say these 6 months are quite important?
They are very important.
The breast milk is that rich?
Yeah, so it gives the baby a good start in life. That's how we say it. Yeah, yeah.
It's like the first immunization.
The first immunization that the baby needs. And then for the mother, it is important when they do exclusive breastfeeding for 6 months, in the studies have shown that these mothers have a lower risk of developing even cancer, like breast cancer, ovarian cancer, and then the mothers who are exclusively breastfeeding are less, they have less chance of conceiving early, because the breast milk has those contraceptive effects if done exclusively in the first 6 months. And for the society, for the nation, and for the family, it's very basically economical. You don't need to buy any formula.
It's
readily available. It's warm for the baby. For the mother, there's a lot of bonding between the mother and the baby.
Yes.
And we are told that children who are breastfed, basically, they are happier children, and it is less likely, the mother is less likely to suffer from things like depression during breastfeeding, and they are less likely to abandon their babies.
Thank you very much.
Yes.
Now, kindly tell me, there are times, and especially when it is the first baby,
yes,
this mother, allow me to say that she's a bit naive when it comes to breastfeeding.
Yes.
And sometimes she feel there's no milk, actually.
Yes, yes.
And especially when the first milk comes, it's not like the real milk.
Yes.
So what should this mother expect, a first-time mother?
Yes, a first-time mother.
How does the milk come?
Yes. So when a mother is expectant, actually the process of production of milk starts during pregnancy.
Okay.
That's why some mothers, when they try to apply pressure on their nipple, they can see some liquid coming from their nipples. Usually it's milk, the early milk. But after delivery, there is that slow progression of production of breast milk. So usually the first 3 days, we have what we call colostrum, which is the first yellow and most nutritious milk that the babies need. Usually it's not a lot, but it is adequate for the baby. But establishment now, there is increased breast milk as in the first week. So from the 3rd day of life to the 7th day, we expect establishment of normal flow of breast milk.
Okay.
Yes.
And that is very educating. Now let's talk about this baby. She's born,
Yes.
but not able to breastfeed.
Yes.
Are there some problems that a baby can have and affect the breastfeeding?
Okay. So the breastfeeding, difficulties with breastfeeding again can be from the mother or can be from the child or just environmental. So to answer your question, from the baby might be born. I told you a baby can be born with problems with breathing. So a baby who is not able to breathe well cannot suckle on the breast because it's a lot of work. Some babies are born with abnormalities. So if a baby is born with an abnormality like a cleft palate, they are not able, opening in the mouth and in the nose. So there's communication between their airway and also their food system. They are not able to suckle well. Or a baby may be born just with infection. So they are very weak. They cannot. There are those mothers who labor for a very long time, so the baby is not able to get enough oxygen into their system. So they suffer from what we call asphyxia. So those babies don't have that energy to be able to breastfeed.
Sure.
Yes.
Now, please tell me, let's talk to this woman who has just delivered, but every time she goes to breastfeed,
Yes.
there's some abdominal pain.
Yes.
Why does it happen?
So for breast milk to come out, usually we have some hormones that need to be produced from the brain to allow for the breast milk to be produced and also for it to come out through the nipple. So there's this hormone we call oxytocin, which is responsible for labor. So usually when the baby is put on the breast, that stimulus itself makes that hormone to be produced. When it is produced, it acts both on the breast but also on the muscles of the uterus. So the mother will feel pain. But it is beneficial for the mother because when it happens like that, it helps the mother to stop bleeding after delivery.
Uterus is where the baby was.
Yes, where the baby was. Yes. So the womb, what we call the womb, where the baby grows during the 9 months of pregnancy.
So, Dr. kindly talk to that woman who is feeling pain.
Yes.
What can you advise her?
So I will encourage the mother to breastfeed frequently and on demand. When the baby needs to breastfeed, she breastfeeds not fearing the pain because the pain is for her benefit. I said it prevents bleeding, but it also helps her tummy to become smaller. The womb will shrink faster. Yes.
So the more she breastfeeds, the better
faster.
For herself too. Oh, that's very good. We are going for a break, and when we come back, we'll talk about the hindrances to breastfeeding. Breastfeeding in a working mother. Why are they not able to go up to 6 months, yet they know they should? Back to our discussion, we are at Kijabe Mission Hospital discussing breastfeeding. Now, Daktari, sometimes a mother understands that she should breastfeed for 6 months, but she cannot. Despite knowing all the advantages, she's still unable. What are some of the hindrances?
Okay. Just as you have said, most mothers actually know that they should breastfeed, yeah?
Yeah.
But usually breastfeeding is not just a mother's responsibility, it's the whole society's responsibility. So first and foremost, there are those mothers who are willing to breastfeed, but they don't have that support, either from their spouses or from the grandmother of the child. So there are sometimes the significant others insist that the baby has to be given something we call in medicine prelactal feed. So the feed that you give before the baby starts breastfeeding. It could be a herb, it could be a drug, it could be a ritual the family wants to perform. So that one hinders exclusive breastfeeding. The other reason is
culture.
Yeah, culture basically.
Okay.
Yeah. The other reason, which is very common, is mother wanting to go back to work. So you find this mother who works 8 to 5. She's working away from home.
And maybe she's the only breadwinner.
She's the only breadwinner. She can't reduce her workload at work, so it means her earning will go down. So they decide to maintain their jobs so that they can provide for the family. So in that case, some they will opt for formula or give cow milk. Yes. The other reasons that the other difficulties that some parents experience, probably a mother gives birth and she's sick. So there are those mothers who are not able to breastfeed. Either they have other diseases like a heart problem, they are being hospitalized, so they're away from the baby, or the baby herself is sick, is not able to suckle. Yes.
No, what about this mother who wants to maintain her shape?
So there's this myth of trying to not breastfeeding because you want to maintain shape. But what I have come to believe is that by breastfeeding, you're actually helping your body to use those extra calories because you are giving it to your baby. So it will help you actually going back to shape even faster than the person who is not breastfeeding. Yes.
Thank you very much.
So long as you do not eat too much, like you take care of your caloric intake. If you are not sure of what you should eat, you can always consult a nutritionist around you or the nurse at the hospital. They will talk to you about the nutritional requirements during breastfeeding.
That is very good.
Yes.
Now, Daktari, kindly tell me, this woman who is breastfeeding,
yes,
and then she conceives,
yes,
what should she do? Now, she conceiving is getting pregnant. Again.
Yes. So
Why?
when we were starting the discussion, I didn't mention that usually it's recommended, apart from the 6 months exclusive breastfeeding, every child has a right to breastfeed for at least 2 years.
At least 2
Yes. So it means if you conceive before your baby is 2 years, you should still basically continue breastfeeding this child. There is no effect of breastfeeding on your current pregnancy. The only adjustment that you need to make is that means you need to eat more, have more fluids, because now you have 2 people basically depending on you plus your requirements. So you should eat better, rest more, because you are taking care of these 2 people. But there's no effect on the pregnancy.
So this milk is not
Yes.
going to affect the breastfeeding of this already born baby. It's not going to affect the other one.
Will not affect the other one. In fact, there are mothers who conceive sometimes when the older baby is 3 months. So that means when the other one is born will be 11 months, they opt to breastfeed both of them at the same time. Like a mother who has twins, they will still breastfeed.
So you wait, when you give birth to this other one,
You still
have
continue breastfeeding, yes.
and there's no effect.
Yeah, there is no effect.
No, kindly tell us about now a mother who has twins.
Yes.
The demand is high.
Yes.
What can you advise her
Okay.
in relation to milk production? Because I guess now she needs more milk for the twins.
Yes.
Okay.
So initially, when they have just given birth to the twins, we know that we talked about the first 3 days when the milk sometimes is not enough. So if that baby is in the hospital, as a healthcare worker, I will be fair to the babies, probably to give them some formula just to transition for those 3 days. But after that, the mother is able to get enough milk to supply these babies. And we encourage the mothers actually to breastfeed the babies at the same time, because usually when they breastfeed one and leave the other, the first one tends to drain both breasts, so the other one will not get enough milk. So we encourage them to breastfeed the babies at the same time, but of most importance is that the mother should take care of herself, because now that means her body will have increased requirements. So like she needs to drink more milk, she needs more calcium, she needs to take, if like her blood level is not okay, she needs to take iron, she needs to take more calories, she needs to drink more fluids, so that she produces enough milk for the 2 babies, but also still take care of herself.
So she's the determinant.
She is the determinant.
The first determinant.
And you remember we said when a mother has prepared her mind that she will breastfeed, it is possible.
No, thank you very much.
Yes.
Let's, just before we wind up our discussion, let's talk about now this mother who wants to go up to 6 months, but she has to go back to work.
Yes.
About the leaving some milk, expressing milk, and
Yes.
storing it maybe in a fridge.
Yes.
How can she do it?
Okay, so for expression of breast milk, there are many methods a mother can use. First, of course, we said she has to motivate herself that she can do it, because sometimes some mothers find difficulty with it. So she can use her hand. So usually we show the mothers how to express milk. So many people think that the milk is usually in the nipple. There's no milk in the nipple. The milk is usually in the glands of the breast. So when they're expressing, they should not express on the nipple, but express on the breast so that it comes. The nipple is like a tap for the milk, yeah? So they can do manual expression of milk, and there are gadgets in the market for storing milk. Milk can be stored in a freezer for even 6 months and beyond. So like if I'm on 3 months maternity leave, during the first few months, the baby will not be able to take all the milk that I'll be producing. So instead of allowing that milk to drip in the clothes and pour out, I will be expressing that milk and storing for my child when I go back to work. The other method they can use to express milk, we have breast pumps in the market. So they will be able to assist the mother, the ones who are not able to do manual expression, that helps them to express the milk.
Now, what about this milk that is stored in the fridge?
Yes.
And maybe she leaves it with the house girl.
Yes.
Should this girl just pick any bottle, or there's an order?
Okay, so when I have my 3 months leave, I have determined that I will do exclusive breastfeeding for 6 months. Even though I'm going back to work, I will start expressing milk. So when I store them in the freezer, I must indicate that this was stored first and this was second, so that when I'll be taking them out of the fridge, I will do it in that order. I'll start feeding the baby on the one that I expressed first.
So first in,
yes, first in,
out.
first out.
That
yes.
is very good.
Yes.
Well, that was a wonderful discussion with Dr. JECINTER Moldi from Kijabe Mission Hospital. Viewers, remember, this is your show. This is Golden Minute Show. I remain your host, Ann B. Remember, this is where we are fighting against maternal mortality. We're fighting against fetal mortality with all love and all passion. And until we meet again from Aziate, shalom, shalom, blessing.